Hello everyone, it's Kim G and we're back again with our pharmacology course, and today we're continuing the part of the pharmacokinetics, which we said before in the previous video consists of the A, D, M, and E parts. The A refers to absorption, the D refers to distribution, and we explained those in two previous videos before, or three. And the M is the part that we're going to explain in this video, which refers to metabolism. Very easy part that has lots of very important notes that you need to know. And without further ado, let's get started. First of all, let's begin with the definition of metabolism. Metabolism is simply the way that your body reacts to certain substances entering your body. For example, if you're administering a certain drug for a specific medical use, your body is not just going to let this drug or substance get or pass by saying hi to all of your organs and do nothing about it. No, it's going to react towards this substance in a way, it's going to change it in a way, for example, or mainly to make it safe for your body to have this drug and excrete it in the most safe or possible way, without just letting it pass by without any effect that happens to this drug. So this is mainly metabolism, the way that your body reacts to the substances that are entering your body or you're administering as medical drugs, for example. So metabolism mainly happens in the liver. Not the main side that metabolism happens in it, but mainly happens in the liver on two phases that we're going to explain right now. So this is our drug, and let's say first, when it enters the drug for, when it enters the liver, for metabolism, first we'll get through phase one. We're going to get through the order of which one is first. Does it always go through phase one, then phase two, then gets excreted? Does it always kind of skip one of the two phases and then gets excreted? We're going to get through that. But first, let's get one by one by saying what are the definitions of phase one and phase two metabolism. So phase one is basically, and some say that it's actually a functionalization process. Functionalization process, I hope I'm writing it in a correct way. Functionalization process, because what happens in phase one is basic chemical reactions like, let's write in a different color. Blue would be cool. Oxidation, reduction, hydrolysis, basic reactions adding functional groups, OH groups, NH groups, and all these basic functional groups that we're adding to our substance that we have for one main reason. Actually, the reason behind metabolism, and this is something that I forgot to mention at the beginning of the video, a very main reason why metabolism happens is to excrete the drug, because you don't want the substance that you administered in your body because of due to a certain reason that you want to treat a certain drug, to treat a certain disease, to stay in your body forever. You want to get rid of it after it's finished from doing its job, which is treating you from the specific disease. So in order to not keep this drug inside your body forever, you need to excrete it. And excretion mainly happens through the urine. Urine is mainly polar, or we could say it's lipophobic. So drugs mainly to get through the systemic circulation and get through your body membranes and the cell membranes of your body, they need to be lipophilic, because the cell membrane consists of a phosphobilipid layer. So when the drug is lipophilic, it gets through the phosphobilipid layer of your cell membranes easily. This is for a drug to be in your body, to stay in your body. It needs to be lipophilic to get through your cell membranes. It has to be lipophilic. So if you want to get it to be excreted more easily, you want this drug to be less lipophilic, which means it's hydrophilic. So by adding these kind of groups, functional groups, by oxidation, reduction, and hydrolysis, you're making this drug more polar. And this is actually what the phase one and phase two mainly are all about. It's about making the drug basically more polar to be easily excreted through the urine, because urine is not lipophilic, urine is hydrophilic. Substances that will dissolve easily in the urine to get excreted outside your body will be polar, will be more polar, not lipophilic. So they are basically hydrophilic. So that's what you need to do in metabolism. To get drug to be easily excreted, you need to make them more polar, which means more hydrophilic. And what about the functionalization? You said it's named the functionalization process. Why is that? Because you could say that it's a pre-stage or a pre-phase for phase 2. Because lots of drugs go through phase 1 first, then phase 2. So we're making these drugs that go through phase 1 before going through phase 2 more ready for phase 2 before it gets to phase 2. So that's why it's called functionalization process. It's making some substances ready to get through phase 2 by oxidation reduction and hydrolysis reactions. So some substances, as we said, after they undergo phase 1, they go through phase 2. So what is phase 2? Phase 2 is called the conjugation phase. Its concept is basically the same concept as phase 1, which is making some drugs more polar by adding polar groups to this drug, like glucuronate groups, sulfuric groups. All of these groups are polar groups that you add to the drug to make it more polar. So basically, the phase 1 and phase 2 metabolism are all about the same concept, which is making the drug more polar to be easily excreted through the urine, which is polar, which is hydrophilic. So it's an easy concept. So something I needed to say about the order of phase 1. So you could say right now that, all right, so all the drugs that enter the liver to be metabolized go through phase 1 first, then through phase 2. Actually, no. This is not what happens in lots of cases. Some drugs, yes, they could undergo the phase 1, which is the functionalization process, then get ready to go through phase 2, which is the conjugation process, then gets excreted. Some other drugs don't get metabolized at all, which are called hard drugs. These drugs just get inside your body and gets excreted without any change to it. That's why they're called hard drugs. They do not get metabolized at all. So these drugs do not have to go through any of those phases. That's the first possible variation. We have another variation, which is a drug that only goes through phase 1 and does not have to go through phase 2. Yes, there are some drugs that do that. Another variation, which is a drug that goes through phase 2 and then gets excreted without having to go through phase 1. Actually, we have another weird variation, which is some drugs that go through phase 2 first, then go through phase 1, phase 2, then phase 1, then excretion. And actually, let's write an example for a drug that does this, which is a drug called isoniazid. Phase 2 first, gets acylated. Acylated means adding an acyl group to the drug. Then after phase 2, it will go through a phase 1 reaction, which is hydrolysis, to be changed into a substance called isonicotinic acid. So this is an example of a drug that undergoes phase 2, then phase 1 metabolism. It doesn't have to be a specific order. So these are the variations regarding the order of the phase 1, phase 2 metabolism, and some drugs that do not undergo any kind of metabolism at all. Actually, metabolism, which is something that I also forgot to mention at the beginning of this video, does not necessarily mean changing the drug from a toxic metabolite when it's remaining inside your body for a long period of time after it's done its specific cues inside your body when you administered it. Doesn't also always have to be changing from a toxic metabolite if it stayed inside your body to an intoxic one. No, actually, some drugs, if metabolism happens to it, it could change into a toxic metabolite, like paracetamol, for example, which is an analgesic that lots of people use. Paracetamol could be changed, is actually not could be changed. Its metabolite is a toxic metabolite, which is abbreviated as NAPQI. This is the metabolite of paracetamol. It's a toxic metabolite that is actually the end product of the metabolism of a drug that you administer. So the metabolites do not necessarily have to be safe. The end product of metabolism doesn't have to be a safe product in all of the drugs. Some drugs actually could change from an active form to a more active form, like codeine, which changes by metabolism to morphine. You know, the very famous analgesic that used to be used in wars in previous times and still used to this time, actually, morphine. Some drugs could change from an inactive form. When you administer the drug, there's something in the pharmaceutics science, which is the science of making drugs and manufacturing drugs, called a prodrug. A prodrug is when you administer a drug in its inactive form and inside your body. By metabolism, it gets activated. These are called prodrugs, and an example of prodrugs is a drug called enalapril. Yes. It's just this note. I hope you wrote it down or saved it. If you have a small space in here, we need to use it very well. Enalapril is a prodrug that is changed by metabolism into enalaprilat. Enalaprilat, which is the active form of the drug. The drug that works as an antihypertensive agent, that's what enalapril is used for, is the active form of the drug, yes. So some drugs could change from inactive to active. It's not always a specific formula for metabolism. You know what I'm saying? That's what I'm just trying to say. Metabolism is mainly the changes that do happen to the substance. What is the type of this change? It's not fixed. What is the order of this change? It's not fixed. All right, so I need you just to note that because it's very important. Some factors do affect. There is a very important thing that I forgot to mention in the phase 1 metabolism, which is that phase 1 metabolism happened by a specific type of enzymes. CYP450 enzymes are the enzymes that make phase 1 metabolism happen. So these enzymes mainly are a group of isozymes, which means enzymes that do have are isomers to each other, have similarities in a different form, but they're not the same enzyme. It's a group of enzymes. All fall under the name of CYP450. One of the most important families of these enzymes is an enzyme called CYP3A4. Enzyme. This is the most important enzyme of all of the 50 isozymes that are found inside these enzymes, and the one that mainly conducts phase 1 metabolism reactions. So this gets us to the factors that we wrote on the board from the beginning of this video that do affect phase 1 metabolism and interact with some drugs at a certain point. What happens if you have a drug that induces the activity of CYP enzymes? What do CYP enzymes do? They activate phase 1 metabolism, which metabolizes drugs, or at least begin the metabolism of drugs. So when you have a drug, for example, like phenobarbital, which is a CYP inducer used with an anticoagulant called warfarin, for example. An anticoagulant, what it's used to, as a drug, what's used to do is to make less coagulation inside your blood to prevent blood from clotting. So if you have a drug that is or that induces the activity of CYP enzymes that induces metabolism, you will increase the metabolism of warfarin, which inhibits your blood from forming clot. You will have a problem. You will have more clotting forms inside your body, because the drug that you're administering to prevent the clotting from happens is metabolized by an excessive way than it's normally should be. So that's why clotting increases. On the other hand, if you have a CYP inhibitor that indeed would affect the metabolism or the effect of some drugs that are administered in the same way. You have, for example, another drug, CYP inhibitor like omeprazole. That's an inhibitor for the activity of this enzyme. Plus, the same drug, I think you guessed what it would do. It won't be metabolized in the same rate, but in a less rate. So its activity will increase excessively in a way that I do not want, which will prevent the clotting from happening in an excessive way, which will lead to the dilution of the blood more, which leads to hemorrhage. So that's why it's important to take care of the drugs that do induce the CYP enzymes activity and the drugs that do inhibit, because these do affect the activity of certain drugs like the anticoagulants warfarin, for example. This is for metabolism. Some other notes that we could say regarding metabolism is the fact that the neonates or the newborn babies actually are deficient in conjugation process inside their livers. They cannot do phase 2 metabolism reactions. So it's very, very important to take care to not give them drugs that are or depend mainly on their safe metabolism to be conjugated. Like chloramphenicol, for example. I will write that. Note on the side. No. Chloramphenicol is contraindicated with neonates. Why? Because they cannot do conjugation. If this drug, in order to be metabolized safely, will need conjugation, and babies do not have conjugation inside their livers yet, why do you give them this drug? So you need to be careful on what drugs like chloramphenicol depend on conjugation metabolism to be metabolized safely, and do not give them to the babies or neonates because they do not have conjugation developed inside their livers yet. And actually, also the product of or the metabolite that results from conjugation will always be less active than the drug itself, except for a certain case, which is morphine. Yes, morphine. Morphine by conjugation changes into compound that's called morphine. Yes, morphine. 6-glucuronate, which is more active than the normal morphine. Other than that, all the other metabolites that result from conjugation are less active than their previous form of the drug before it gets metabolized. This is basically the basics that you need to know about metabolism regarding the pharmacokinetics. You need to know these basic concepts because you will get to them more when we get through the pharmacology course and start explaining in deep details about this. This was our video for today. I hope you enjoyed it. If you have any feedback, please let me know in the comments. And thank you for watching the video and have a great day.